Thank you for joining me. So before we get into your work as cardiologist, I would love to understand you a little bit more and just understand your background and your early years.
How early do you want to go back to now?
As early as you're comfortable with.
So I grew up in Stillorgan. I went to school very locally in a Montessori school. And then I went on to school in a place called St. Michael's College in Dublin. And my early years there were 4 kids in the family, 3 boys and 1 girl. And we had a great kind of family upbringing. One of the things that's relevant to the conversation is my dad was a surgeon and my mother was a surgeon. So there's a certain natural reason that comes up in a minute as to why I ended up doing what I do. We had a very happy childhood growing up. We had a great time, played lots of sport. We all ended up going to the same school. We were all very close. We did a lot of great things, lots of nice family holidays and all those sorts of things together.
Wow. A family affair. What was the discipline that your mother and father specialised in?
My parents were both surgeons, which is different to me. So my dad was a urologist, so that's all the kidneys and all those lower bits. And my mother was an ophthalmologist, and she was an eye surgeon, so she operated on people's eyes. My sister is actually an ophthalmologist, and I have a brother who works in IT. So whereas I'm a cardiologist, which is more, I do a little bit of, I wouldn't quite call it surgery, but it's like surgery. So the decisions that led to me where I'm at, I didn't want to be a surgeon. And so ultimately I became a cardiologist out of choice.
And what drew you to medicine? Was it the fact that it was in your family, it's what you knew? Or was this, was it encouraged? Was this genuine, real love for it?
I think it was all of. One of the memories I would have of my mother my father compared to my mother is that my father worked all the time. I mean, my father worked every single day of the week. He operated on Saturday mornings as well as Monday to Friday. He'd have Saturday afternoons off, so he'd go off and pursue his own different interests. And on Sunday, because he'd operate on a Saturday, we would go into the hospital with him as kids. We would go onto the wards, we'd meet the patients, we'd say hello to everybody.
Wow.
We'd get something to drink, we'd probably get a few free biscuits. It got better from time to time in terms of little chocolate bars, all the very healthy things you find in hospitals. So there was a lot of that, and there was a lot of exposure to health. My mother was very wise to the fact that she didn't work at the weekend. She worked very much Monday to Friday, and she managed to organise her time very well. Medicine was everything, in our world growing up.
And when you were training and what you thought success in medicine would look like then versus now, is there a difference?
It's very difficult to measure what success might be. I mean, success might be a lot of money, which is, a difficult question to answer. I think in terms of impact, it was probably a question where success might be that you would treat or help a lot of people through life, or you'd maybe help even more than a lot of people, like you might help millions of people. Or that you would kind of feel the idea that you might be curing people. And I think the idea of curing people is probably something on my journey I've kind of learned an awful lot about. A patient said to me a couple of years ago, says, "Robert, you should concentrate on retiring yourself out of practice." And I was kind of going, retiring myself out of practice in my 30s, I'm not quite sure about that. But when I kind of had a bit of moment of time to think about it, it was effectively that I should cure everybody so they wouldn't need to come and see me at all in the first place. So, and a lot of the journey in that and my interaction with people has probably, like the practical aspect of coming out of a training as a doctor, I think the practical learning, the interaction, the time you spend with other people is really what's informed me. And so the success has kind of grown on that experience more than anything else.
And what was it about cardiology that became your specialism, your area of interest?
Having grown up as the son of 2 surgeons, always was of the opinion that I didn't want to do the subject that my dad did for different reasons. Wasn't sure about doing the eye. I felt it was a very small part of the body. It really didn't attract me. Then the idea, I thought next maybe I'd be an anaesthetist to put people to sleep. But the idea of standing there for hours just didn't appeal to me either. So then interestingly, when I came out of medical school, myself, my 2 closest friends, the 3 of us had no idea what we wanted to do after we graduated. We spent our first year in hospitals. The 3 of us met each other and said, what are we going to do now? I mean, we've done the medical school. We're now doctors. What are we going to do? And ironically, the 3 of us, our fathers all went to medical school in the same year in the same college at the same time. So it was fascinating. So I went to see one of my friends' dads. One of my friends went to see my dad, and we all integrated. So two of us applied to do cardiology. One of us who didn't, he went off to do radiology, and the other guy went off and did radiology himself. Now we're all extremely happy with those choices. I was drawn to cardiology because I really wanted an area of medicine that was very acute. So you'd save a life and everybody would be better. And I thought that you wouldn't have a huge volume of patients or clinics or longer term care that you'd have to do. In truth, that's completely the opposite to the way it's actually panned out. And then I suppose there's a personal story in all of this. I said I had 4 siblings. So one of my siblings died when I was in medical school, when I was in final med, and he was in third med. So he unfortunately dropped dead of sudden death. And I wasn't sure at the time whether that influenced my real desire to do cardiology. I wrote a book about 2 years ago, and I put a mention I put it in the front of the book that his death had some kind of serendipitous effect as to why I landed in cardiology of all things. So I think whether that's true or not, I'm not entirely sure, but maybe there is a coincidence.
Yeah, it's played a role.
Yeah.
It gave you a purpose potentially, which I can fully understand. And reflecting on your career to date, how would you describe the evolution from early years to where you are now?
When I chose to do cardiology, there's a training system. So the training system is you have to spend 6 years to become a consultant or become eligible to become a consultant. That's having been in medical school for 6 years and having done 3 other years in general training. So part of the 6 years is you travel or you're encouraged to go abroad. So I went to the UK for about 3 years. I did a PhD in clinical pharmacology. And then I had to come back for a year because the system mandated me to do that. And I was very happy here. I got married that year. And then we went to America, and I went to work in a hospital in North Carolina, and I spent 5 years there. I spent 2 years as a fellow and 3 years as an equivalent of a consultant. And that was a really, really fantastic time in my life. I was just married. We had our first child. We had 2 more children when we were out there. It was just everything happening in life, everything happening in what I was doing. I was really happy with the people I was working with. I made some great friends. And then ultimately an opportunity came up to come home. And I thought I was going to end up in a big public job. And there weren't any public jobs at the time. And so it was kind of, well, where do you go next? Do you stay in America? Do you come home? And so I came home and ended up in private practice, which I've stayed in since then. And part of the decision to come home came out of the fact that the visa system in the US at that time, which is 19 years ago, the visa system in the US at that time was I had gone into the country on a J1, and so there is an obligation to either leave the country for a year or 2 or go and work in some very underserved area of the community. So I left the country on the idea that I could always go back in 2 years' time. But part of the learning over time, part of the learning with travel, which I think was the biggest learning I got, was to travel. Part of the learning with having young kids and growing up in that situation as a fellow, which pays very, very little money compared to even what you get as a junior doctor, and having to get through that is hugely personal learning. And then the other side of things is when I became a consultant in America, one of my colleagues said to me, we're running this leadership program for physicians. This is, let's teach doctors how to be leaders and run departments. Now, I was not in charge of the department, but the person involved was one of the departments, said, this is a great thing, you should do this. So this turned out to be the leadership module of their MBA program for their business school. So I did the leadership module. Now, an American leadership module on an MBA, you meet Army generals. So when I was in America, the Americans had gone to war in Iraq. I got to treat people who were on the front line of Iraq, who were the Army generals making decisions. They used to come home every month from Iraq to get kind of retuned and sent back out again. So you got to meet football coaches. You got to meet really serious people of all different aspects of life. And it was really, really powerful learning for me. So when I came home a year later, not only did I start a new job, self-employed, new practice, we had twins 6 weeks before we came home. I also decided to do an MBA just for the fun of it. I did a general MBA when I came back. And one of the things about going into medicine in the early days was I, in 5th year in school, really wanted to become an economist. I don't know where it came from. And then in 6th year, I decided I did not want to be an economist. There was no justification to it. I wanted to do medicine. And somebody said to me a while back, well, you could have been very unfortunate if you did become an economist, because given your age group, you might have been in prison at this stage and you might have never had the rest of the life the way it's turned out to be. So that's a little whistle tour of where things have come to.
To go back to what you mentioned about a leadership course under an army general, is that what you said?
So the leadership program was run. It was run by one of the consultants who works in the group, in the hospital group now. So he just gave me an opportunity. Said you should come and do this. So these are all the new head consultants of all the departments that were hired that year. But the program was split into a lot of different modules. So you're sitting there listening to the story about the War of Independence as your entry module for American leadership. I mean, it's very traditional. It's very strong rooted. But North Carolina has the largest U.S. Army base in the U.S. So all the soldiers are, they train there, then they go to sea training in California. There is a certain element to that. And the hospital I trained in is a publicly owned hospital. So it treats a lot of those people. So there's a very strong tradition. So the MBA comes from a very strong culture and a very strong tradition. And where I was is in a place called Chapel Hill in North Carolina. And in Chapel Hill in North Carolina, it's very much a university town. The university has a couple of very, very famous graduates. But the other side of it is that it has a very large university campus. So it has a business school. So it has a very well-known MBA program. But it was just a really interesting opportunity at the time. It really turned me in kind of seeing the other side, what I thought was a business side to medicine. It led a lot to, as I said, I did an MBA when I came back. It's led a lot of learning to me, primarily because I didn't go into the MBA to become a businessman. I came into the MBA program really for my own personal development.
Yeah, wow. We chatted previously and you described seeing mainly executives with the people that you're working now and seeing patterns and people coming to you with the, same patterns of behaviours and typically when it's in crisis mode, and it's encouraged you and driven part of how you practice now. What was it that you were seeing that redirected or forced you into a position or where you changed tact?
I would have to say that life as a private practice consultant is long hours, like my father, very busy, you're self-employed, and so pressure is high. And as well as that, if you're in cardiology, you're treating people coming in with heart attacks, you're treating acutely, life-threateningly sick people. That's one type of pressure, but you train for that type of pressure. It's like flying an airplane, that you're trained to deal with that. But running the business and doing all that is an awful lot of pressure and a certain amount of stress in what you do. I think somewhere along the line in the early stages of my career, I was introduced to this thing called lifestyle medicine. And a GP colleague in Ireland said to me, you should go to this course in America. You should just go there open-minded, have a listen, see what you think, and let's catch up when you come back. So I went to this program in Harvard, which was all about this field of medicine called lifestyle medicine, which I honestly say I'd never heard of. But then it was all about exercise. It was about diet. It was about stress. It was about sleep. It was kind of saying, well, I can't believe there's a medical field that does all that. And then I kind of realized how relevant it was to managing things in life, in patient care, as much to try and prevent problems. And then I just became more and more interested to unwrap the idea that stress, what was stress about? Stress is a huge cause of illness. And then just repeatedly you see like very stressed out people. You see very stressed out people who don't sleep very well. You see people who react to their pressures by eating a lot of the wrong food or eating too much food or drinking too much alcohol. And you see a lot of people who give up their time for when they should be looking after themselves. So they give up exercise or they give up time at home because you're working all the time. And so through the combination of that and then applying that and listening to the patient's stories, this kind of started to really resonate and say, well, hang on a second, these are all the problems I'm actually seeing in my patients. This lifestyle medicine thing is a real medical specialty. It's like cardiology. This has a huge place to play within cardiology. And while some people will call it preventive cardiology, and in preventive cardiology, invariably you see somebody who puts you on a lot of tablets to prevent you having problems. Now, most patients don't want that. Most patients want other ways that they can improve their own health. So the idea that you get people to exercise or you get people to change their diet or you get people to manage stress or change their sleep patterns is very, very relevant. And then going beneath the surface and identifying that the specialty is totally evidence-based. So it's no different from cardiology or any other medical specialty. And it has really, really abundant evidence For example, if you lower your stress levels, you have a lesser risk of having a heart attack or a stroke. If you do the same with improving your sleep patterns, if you do the same with your diet and with exercise, they're all hugely, hugely beneficial to the risk of having a heart attack, to the risk of having cancer, to the risk of having a stroke, to the risk of developing Alzheimer's disease. It really, to me, that kind of aligned in an almost perfect way. And then I was fascinated to discover that not a single person in Ireland actually was practicing it as a physician. The GP who suggests I go on the programme, he actually does. He has a lot to do in primary care in the same space. But it's just interesting to see that while it's very, very popular in the US and it's really emerging in a very big way, it doesn't seem to have landed so easy in this part of the world. Probably because there are some people who get kind of lost to the idea that it's either very woo-woo and a lot of the stuff is kind of a social media creation, when that couldn't be so far from the truth. I mean, it's and so bringing that into cardiology, totally different for patients. So, and what's really interesting about lifestyle medicine is that the premise of it is you coach patients how to change behavior. When you're a doctor, you learn how to tell people what to do. You learn how to write a prescription. You learn what drugs you go on the prescription. You come to see me. There's your prescription for your cholesterol. Off you go. When you come to see me now as a cardiologist with a lifestyle medicine interest, what I will provide is a very elaborate discussion around what you eat, around the exercise, around your stress and your sleep. And I'll try to identify which one of those, with your help, is causing you the greatest problem and try and do something to help you deal with that. So, what had turned out to be a learning, almost a self-learning or conversations with some other, innovative doctors had led me to this. And really it's been quite transformative in terms of the way I practice cardiology. And it's been very interesting because the feedback has been quite phenomenal, both from patients, but also from colleagues, from particularly from GPs who kind of say, like, you really have this great approach to the way you do things. And I mean, I keep on saying, well, it's very obvious. I said, it's very interesting. It takes somebody like that or like me to actually show it makes a difference.
So is Ireland, are we slow to adopt, or is it just lack of interest, or what's traditional medicine's response to more of a lifestyle approach?
I don't think we're slow to respond. I think a lot of people are very interested. I think if you go to see a lot of the GPs, particularly female GPs, you'll find there's a growing interest. I get conversations with GPs who want to get into lifestyle medicine in their practice. I keep on saying to them, well, if you're already very good at something, so say you're a runner as a GP, sometimes it would make more sense that you spend some time talking to your patients about physical activity and about going to the gym. Whereas for others, if your interest is around nutrition, maybe that's something you should talk to people about. But you can't expect patients to change everything overnight. You really have to go about it in a very methodical or slow type of way of doing it. And realistically, if you want it to last, you have to do it that way. So I personally think that it's growing. We set up, or I was one of the group, we set up what's called the Irish Society of Lifestyle Medicine, which is largely for doctors. It's been there for 2 to 3 years. We're getting there. There's a webinar every month, so it's very informative. We have a lot of GPs bought in. I also sit on a European Lifestyle Medicine board, which runs its own teaching program, creates a significant level of interest. And it's interesting to see how it's developed in Europe. I think in Europe, you get a slight difference where you get engagement from everybody you could think of, So you might have, we had our annual meeting last year. We had the head of Zumba flew in from Florida to teach the medical values of doing Zumba classes. So I mean, a lot of that gets lost a little bit in as I said, the woo-woo factor. But the idea is just more to encourage people to take exercise and find something that you like doing, which is good for you. So I do believe it's getting bigger and bigger. I'm fortunate that I've got in there probably first, and so but I mean, wearing kind of that leadership hat again, it's really just trying to empower people, engage people as to the value of following through on these things.
So you work closely with high-functioning CEOs and entrepreneurs as part of your day-to-day private practice. What is the typical health profile of the individuals that come to see you?
It varies on age group. It varies on male, female. It varies a lot in terms of the type of businesses that you run. It's interesting that when you see people coming from lots of different businesses, a lot of the same businesses, you get the same story. So the real big challenge you come across in different leadership groups is that a lot of people in Ireland, and I'm sure it's universal, think we're all invincible. One of the commonest phrases you get out of men is, "it will never happen to me." So you feel absolutely fine and you assume, sure, I'd never have a heart problem. Sure, I'm fine, even though you might have the worst set of lifestyle behaviours we just spoke about. Interestingly, when you deal with women as patients, women have this fantastic maternal instinct, which is they look after their kids really well. They look after their parents, particularly their mothers and fathers, even better. They make time to look after their husbands and everybody else, and the only person they don't look after is themselves. And you see that universally, whether they're leading the home or whether they're leading in the office or whatever it might be, universally that. One of the biggest sources of stress you come across is managing other people. Very consistently very consistently, whether it's to do with who the people are, what they do, or certainly a lot of people seem to feel like they have to take responsibility for every single person's individual decision, which would seem that you just take on, if you have 100 people in the office, it would seem like you take on 100 extra decisions on top of trying to make a decision. And that seems to come through universally across a lot of different industries. So I think it's largely that what you see. The challenges, they all lead to health problems depending on your ability to manage those situations.
Mm. And when you're operating at that level, the pressure is not going away. You're actually creating more pressure, more opportunity, more. And, the downside of ambition, or it comes part and parcel of being in that senior entrepreneurial or leadership role. And I think people can deprioritize health. And as you say, it's not going to happen to me. Or I think potentially even ignoring warning signs. Is there common warning signs that people ignore?
People actually ignore everything because the idea that it will never happen to me or it couldn't be that is, you get chest pain and you kind of go, oh, it's not there all the time. So really it's not that bad. Or it kind of radiates from my chest down into my tummy. So it must be indigestion, or I was out for the weekend, or, I ate the wrong food, or et cetera, et cetera. So there's always an attempt to minimize what might be something more significant. Sadly, particularly amongst men, you come across a large proportion of men who know they have a bad family history of heart disease who don't do anything about it. And invariably, when men do respond is when somebody in your social group or somebody who you work with drops dead. So I get a lot of patients who will come in because a friend drops dead. I'll get a lot of people who come in because somebody at work drops dead, which is really terrible that it takes that to actually trigger some people to respond to their health. And I think that I think the pressure of life where you try to take on everything, but you assume that that's all business related or it's all related to running the company. Whereas ultimately, if you don't look after what's the petrol that's in the body, or if you don't look after the engine, well, then you can't expect to not get sick. And unfortunately, as I've just said, some people drop dead on the job in those very busy roles, where the real shame, as far as I'm concerned, is most heart disease is completely preventable. It may just be that you need to go and have a medical, but a medical that you actually see it through, that you go and talk to the doctor about the numbers on the list of tests you have done. Or I advocate for certain tests because they're invaluable.
Yeah. So when somebody comes to see you, do they come to see you in an acute, in a reactive capacity, or are you seeing more people want to take preventative measures that are just more aware of the stress that being an entrepreneur or a CEO brings?
I've certainly found that since I wrote a book, since I did a TEDx talk, since I put myself out there an awful lot more, particularly on LinkedIn as an example, that attracts a lot of people who want to get checked out from a health point of view. Definitely does. It definitely spreads the word of mouth around people, which is where, as you know, most of the communication, at least in this country, seems to happen. I think, yes, there are acute people who come in. They come in with heart attacks. They come in with issues with their heart rhythm. They come in with some of those problems. But the number of those versus the amount of people who are kind of sent on either by a GP or else sent on of their own request. It's interesting in medicine how your wife might be a patient and the next thing she refers you, and then the next thing you refer your siblings. And, it's nice because there's a certain sense of trust and closeness to that. But I think that I think the reality to it is there'll be about 80% of what comes to me will be that referral of some concerns of family history or high cholesterol. I think a lot of people out there don't necessarily come in that group. I think that's a problem, because what people don't understand is that the highest reason you'll drop dead in this world is from a heart attack. And the risk of that is about 30% of the death rate universally around the world. I mean, it's the same, and that hasn't changed in about 50 years. So one of my big reasons for doing what I do is that I put stents into people. I treat heart attacks. I can get you out of trouble in that way. I can genuinely save people's lives that way. But when I put stents in lots of other people, unless you change the behaviours that give rise to why you get heart disease, you're going to need more stents, or you mightn't be so lucky, and you might find that the stent you have doesn't work, and you might find you don't survive as a consequence of that. So dealing with the origins of the problem is actually where the whole sort of journey has brought me, because patients just continuously come back with either chest pain or other symptoms. And I know for a fact, because I've been doing this for nearly 20 years, it's always the patients who decide that, oh, sure, I know better, Dr. Kelly. Oh, I know I should have stopped smoking. I know I should have done these things. It's always that group of patients who gets into trouble. The ones who actually make the changes don't get into trouble as easily.
Is it mainly executives that you work with now in the later years? So do you have a concern about the health of our executives? You know, how okay, yeah. So
the big concern I actually have in terms of cardiology and heart disease is messaging and getting across to people how significant it is. And so in some respects, telling people that you're going to help them, you're going to nurture them, you're going to teach them how to walk, do all this sort of stuff, falls on deaf ears, particularly of very intelligent, very smart executives who are very much high achievers and have got to the positions they've got in hard work. And so my whole sense at the minute is much more about trying to equip that group of people with the skills to perform even better. And the important part of this is keeping your heart in good condition. And you have to keep your heart in good condition to be able to do that. So that is about what we've mentioned. It's about the stress, it's about the sleep, it's about the diet, it's about time to exercise. It's about looking after yourself and making time for that, because ideally you perform even better. You'll even get higher, tenfold, if not more for some of you, than you currently do. And one of the huge things around the sleep and the stress heart story is the idea that people who struggle to make clear decisions, this is called executive brain health. People who struggle to look after decision making, in my world, if that happens, you could hurt somebody doing a procedure, or you could make a mistake in a prescription. In your world, that could be maybe there's a zero or an extra zero put in the wrong place. Maybe you make a decision that causes the company to have a disastrous outcome. So that particular aspect of your heart health is also very, very relevant. And then, I mean, if you run the company and you find out that the CEO goes and gets sick and has a cardiac event, the whole company falls apart because of the fact that the health situation was never considered. It was never a priority. And then beyond that, if you ultimately want to be part of this big longevity movement and you want to enjoy the rewards of all your hard work and everything you've ever achieved, well, the only way you're going to stay alive for long, and if that might be 80, 90, or even beyond that, the only way that's going to happen is if you look after your health.
And even what you said, 80% of heart disease is preventable, which, and that really is a stat that can empower you or give you a sense of hope or a sense of control. And as you said, intelligent, self-aware individuals that are running businesses, why do you think the knowledge struggles to turn into action? Making that change, having knowledge versus carrying out the knowledge.
Effectively, that's the knowing and the doing gap. So you know what to do. I mean, we all know that there are certain things that affect our health. We all know that smoking, for example, increases the risk of cancer. And yet, a lot of people who smoke cigarettes don't stop doing that. If you take New Year's resolutions, brilliant example. You go on a New Year's resolution, you usually decide it the week before New Year's. By the 21st of January, 95% of people have broken their New Year's resolutions completely. And the same is true in terms of if you want to lose weight and you go on a diet. You go on a diet, 6 weeks later, you're down a couple of pounds. This is great. 6 weeks after that, it's back up again. And the reality to a lot of that is down to the system or the way it works. It's not down to you. It's down to the fact that you can't use your motivation and expect that everything's going to change forever, because you can't keep it going that long, no matter how much willpower you think you have. What you can do is work in a way that you make the whole process much more easier to do it. And I spent a lot of time in the last sort of 8 or 10 years trying to define that and trying to apply that across the spectrum of patients, leaders, executives, to try and just help people make changes in an easier and longer lasting way.
What does the invisible damage phase mean? Like, what is that?
One of the frightening things that most people will not be aware of is that heart disease, i.e. forming plaque in arteries, can start as early as in your 20s. Now, you won't necessarily pick it up at that stage, but the process can. There's a lot of blood tests that we now do to look at people's risk for whether your cholesterol might be a future risk to you, even if it's a normal level. So we do certain blood tests to identify that. We can identify a risk that you might develop diabetes in the next decade. So, all these processes happen early on in your life. But the opportunity is there if you make the changes at any stage of your life that you can undo or you can manage the kind of silent process that are there. But I send a lot of patients for scans, what are called cardiac CT scans that measure plaque in arteries. 60% of the male population of this country will have plaque in your arteries. 40% of the female population will as well. So, over half of the Irish population already have plaque in your arteries. The challenge is if you don't change your behaviour, if you have a very stressful job as a senior executive, you run the risk of activating that plaque to cause a heart attack or a stroke or the risk that you might drop dead.
Wow. Okay. I'm like, I need to sign in. I need to come and get a scan. So, wow. When you start to hear it, when you start to face the stats and face the reality, sometimes I think people can just live in denial because it's a little bit easier, because the task that's ahead of them, they just don't have time to think about it, to fit it in, to give it the attention that it needs, but potentially to the detriment. And pressure is just not going away. And people are traveling, they're building businesses, they might not be a natural person that exercises, that enjoys movement. What predictable behaviours do you see around food, sleep, movement that are negative behaviours versus positive behaviours in the people that you work with?
If you tease it out in terms of the different pillars of lifestyle medicine, as we call them. So people, when it comes to sleep, some people know that you should sleep between 6 and 8 hours. Doesn't really matter that much. What really matters is the quality of sleep you get. So if you wake up the next day and you feel recovered, invariably it usually reflects good sleep. If you don't, on a consistent basis, then there's something going on with the way you sleep. And that might be you have a medical condition that you snore, which is a sleep apnea condition. You might have very restless legs. Invariably, what I see in most patients is you work so hard, you come home, you might have dinner late, you might have a drink, you might go back to working at home, you get to bed late, your head is all turned on, it's confused, you can't sleep in that, you're very agitated, and you live on that kind of hamster wheel indefinitely. You live on that forever. That's a very, very typical sleep story. And invariably, you find there's a lot of stress that goes with the origins as to why that happens. You also find that a lot of patients eat very unhealthy. They drink too much during the week. They don't, as you say, nearly everybody is time poor, but that's an excuse. You control your own time. You either factor in every day, 7 to 8 is my exercise time, and you stick to it. You either do that or you don't. It's a choice. And I think so a lot of the time influences your willingness to change a lot of those behaviours. But they do get you. The sleep deprivation is going to affect your brain health, whether you like it or not. You can't keep going that way. And I think that that's where I see a lot of that. So I see a lot of that where people just feel under pressure. People almost call out that they really are struggling to manage the whole things. I find it very funny having the MBA that some of the patients I deal with, I almost take the hat of the cardiologist off and have another conversation as to say, well, how should we restructure your business? And I kind of go, well, I need them to send them to somebody to do this. But it's amazing how a lot of people, as much as health might be a priority, just don't see it. And they don't see it because there's so much going on in your head. I find it's one of the most fantastic things to learn how to do is to almost declutter your mind. Some people get into this habit in January where you declutter everything physical for 21 days. But one of the most fantastic things is just to clear your mind of an awful lot of different things that are going on. Gives you an opportunity just to see exactly the way your life is actually behaving or you're behaving. And again, I would hope it's an opportunity for you to realize maybe I just need to make some time for this, and then you find a way to do that.
And you mentioned sleep and stress, nearly in tandem there. Do you have, when you're working with people, what role does nutrition and food choices play in all, especially when you're talking about plaque? What role does that play for you when you're having these conversations?
So as I said at the beginning, an awful lot of patients have all of those problems. Ironically, I think I find in Irish people there's an awful lot of people who do actually exercise. Now, some do a lot of running, a lot of cardio, and do very little resistance, weight-based work, which is really important for you as you get older. In terms of nutrition, I run a coaching program for patients and for executives in terms of your heart health. I will honestly say that the universal goal of nearly 90% of people is to change their eating habits. Now, a lot of people might say that's because, I don't feel stressed or I don't feel that sleep is an issue. There are little things in people's minds. But definitely people are very engaged about the fact that they see their eating as an issue. The challenge is to try and help people make changes in that, because if you take the diet industry where everybody's getting, or the vast majority of people might get success and then subsequently it's all very yo-yo. So the weight comes on, the weight goes off. Or even people taking the new injectables where people are not following through and looking after what they're eating. And yes, if you eat a diet that's very high in cholesterol, or it's very high in sugar, or it's very high in fat, unfortunately, they're all the things that are bad for you because they cause heart attacks and strokes and cancer. They're all the things that are called processed food. They're all the things that are in packets. And yes, because of time, because of convenience, because of the way the world is, we all, because we're too busy and don't see ourselves doing it, still go and behave that way. So I'm a big advocate of what's called a Mediterranean diet. It's not a diet. It's a way of living. It's a lifestyle choice. It has an interesting component of it where you have to be more sociable around the eating. So trying to get home from work to eat with your kids. Do you know those people in your life that are actually that are there that you might meet when they're 25 because you've been working all the time, and equally slowing down a little bit, which some people call that mindfulness, but the reality is just that you're not eating on the rush, that you actually have that time, that the phones are turned off, that people actually talk to each other. And I think that's really, really important, as well as the food that you're eating. And that's the reason that the Mediterranean diet is really well researched. And the Mediterranean diet cuts the risk of heart disease in half, so by about 50%. That is better than most medications out there. If you don't like meat, there's an American version called the whole food plant-based diet that achieves exactly the same thing. So these better eating plans serve you much better, not just for your heart, but for all aspects of your health. While there are a lot of other diets that people like to go on for losing weight, they do not have the same evidence to protect your health. And I think it's really, really important. There are a lot of people who'd like to blame everybody else. We'd love to blame the industry. We'd love to blame the supermarkets. You'd love to blame the government for all of this. But the reality with all of those things is it's ultimately down to you, the individual. You decide what you eat. You make the choice. If your health is important to you, which I really hope it is, well, then you should be able to work out what you should and you shouldn't be eating all the time.
And for anyone that is, let's say, interested, what are the components of the Mediterranean diet? It's in a simplification that somebody could make an adjustment.
So one of the things that I have learned in terms of the way the diets and the New Year's resolutions really just don't work is I follow principles from somebody who taught me coaching, which is a guy called BJ Fogg, who's a behavior designer based in Stanford in California. And BJ Fogg has a really simple method to try and help you change behavior. It's called the Tiny Steps model. And the Tiny Steps model is about making things very easy for yourself. So one of the factors to that is if you want to change to a Mediterranean way of eating, so Mediterranean has lots of fruit in it. So I will say to patients, well, why don't you just buy a punnet of blueberries? And why don't you add 2 blueberries to your breakfast every day for the rest of the week? Just do that. Or you might add another 2 in the evening. So we recommend for everybody to try and eat 2 to 3 pieces of fruit every day, that you try to consume 5 different vegetables. Now, these are fresh vegetables. So the point to it is you could add 1 set of vegetables if you were poor to that. You could add 2. You could vary the color. You could add it that way. And so you're trying to replace bad habits by having healthier foods. And there's a lot of different ways to make life easier. Some people are so busy, it's easier just to make all the food in one go on a Sunday evening and have it there for the whole week. Or some people find the work is very distracting. So maybe it's easier to make your lunch and bring it with you in every day. I have a big issue in trying to get people to drink more water, because most people are really bad at doing that. And just gradually bringing these things in so this is what I try to coach people to, is just setting a goal for yourself, trying to achieve that in the week. Let's just try and get the breakfast right. And then I try to share with you some variety. I'm not into writing the recipes for you. You can work that out yourself. Part of the creativity and the fun is doing that yourself. And then just trying to work you through the next steps in terms of dealing with lunch, dealing with dinner. Other people like to fast, i.e. not eat after a certain period of time, often 7 o'clock at night. Some people will move that, not have breakfast and move to lunch. Fasting is very good for your mind, believe it or not. It's very good for longevity. It is very good for blood sugar control. So there are some variations that I will personalize to some patients. But I think that, again, trying to integrate all of these things, not just the Mediterranean diet, but also other behaviours, I find doing it that way, it genuinely works.
I'm a big fan of fasting. I used to be very strict with it. I'm a 16-8. I can't quite, and sometimes even getting to 16, I'm like nearly falling over. But I used to be very strict with it. And what I found was I had to readjust my training, my exercise to fit where in a window where it was really early in the morning that I'd just woken up, or after I've eaten. I'm probably more 14 hours now, just because, having child and life changes. But fasting, I remember the first time I drank an Americano in my fasting state, and I was like, I was like so full of energy and clear, and I experienced that.
One of the house doctors in work said to me, Dr. Kelly, it's a 24-hour clock. So instead of doing your intermittent fasting from, say, dinner time, the idea of fasting is that the best fast is when you go to bed at night. If you go to bed, you sleep for 8 hours. That's 8 hours of fasting, unless you've got a stash of sweets beside the bed and you're up to something else. But the reality is there's 8 hours of window, so that's fasting. So if you move that to 16, what most people do will stop after 6 o'clock in the evening. The next meal usually be midday the next time. You can still have glasses of water or cups of tea without milk in that period of time. But you can shift the day around and say, well, you know what, I like breakfast and I like lunch, and I'm going to fast from the early afternoon from 2 o'clock and bring it round to the next day. But the real value in fasting is that there are some people, it's very good for preventing diabetes in patients. It's very good for longevity. A lot of people feel an awful lot better from it. And again, my old sense in this is of personalizing it. I do not believe everybody should be doing intermittent fasting. I think it works for some people. And again, like all of these behaviors, it's about making it habitual. It's not about, I'll do it once and sure, we'll see. There's a very well-known nutrition expert who in the UK called Mike Mosley, who sadly died a couple of years ago. And Mike Mosley wrote a lot of books about what he called the Fast 800 diet. He wrote another book called the 5-2 diet. And the 5-2 diet is an intermittent fasting to the point that you eat less calories and you fast 2 days a week, and then the other 3 days or the other 5 days you kind of do what you like. All purely programs to try and help people lose weight. The same is true of his other programs. And there's a lot of other nutritionists in the UK who advocate the same type of approach. So, it depends on the individual. But as you said, where it puts you under a bit of pressure, if you're a very busy executive leader, trying to do fasting as the first step in your kind of list of tools to try and improve your nutrition is probably not advised.
No. Well, I think I've seen the meals in a bottle now as well, that's so... that there's everything to encourage an executive to go. Have your dinner in a bottle, have you this.
And I think there is a lot of that. And there's a huge movement around protein at the moment as well, where every company in the world seems to be making protein.
Yeah.
And I think that the challenge is, one of the other things, you may not buy your own meals. They might be bought by other people, is to actually know what's on the list or the label of those packets, because a lot of those are flavoured with sugar so that they taste nice. And so the reality, as much as you think you're gaining, you're actually not gaining all the healthiest stuff. The best diet in the world actually is natural. It comes from the ground. And in fact, if you keep to things like the Mediterranean diet, you'll get most of the protein that you actually need from day to day. There won't be a need to take all the other foods that you find might be convenient to buy a packet and pick that up for lunch or for dinner or whatever it might be.
And when pressure is sustained and is not going anywhere, what should people focus on as a let's say a priority? What do you think can make the most impact if nothing's changing for them?
So I like to see this, that if you think you're stressed all the time, that's usually your brain that's doing it to you. Whereas there's an important connection between your brain and your heart, and that is your heart's controlling your heart rate, it's controlling your blood pressure. And so they're all what you feel when you're stressed, and you feel that the heart is on all the time and the blood pressure may be high. And you're getting all these kind of physiological effects. So the idea is if you find a way to calm that, you get yourself into a much better position or a much better state to actually be able to deal with a lot of the pressure you're under, or you get a chance to step back from it, or you get a chance to get better quality sleep, or you go out in the fresh air, or you go for a walk, as an example, that you try to get clarity in that way. I firmly believe that you should also go and see a doctor within that situation to be checked out that nothing is going to come and happen to you as a consequence of that sort of chronic stress, struggle, frame of mind that you have. And then I do think beyond that, there are so many tools, there are so many ways to take back control of that. And there are so many ways, in truth, if you do that, to make you even more successful at what you do as a consequence of having everything working for you.
And you mentioned tiny steps previously, and you built the heart reset model. So it's about smaller steps rather than taking on large endeavors like trying to fast as your first solution.
Yeah.
What success have you had with longevity and building new habits with tiny steps?
You asked me earlier on about my own personal development.
Yeah.
And when I, as I said, I did an MBA for my own personal development. I was looking for something. I wasn't quite sure what it was. And I did an MBA 10 years ago when the whole technology play was around disruptive innovation. It was all about these gadgets to measure your heart rate and do all this stuff to integrate your health. And this was really kind of the cutting edge. It was amazing what you could do for people and for patients. And then as you move that forward to now, in terms of all the different things that we can offer for patients, in terms of the tiny steps, everybody is offering these small steps now. Everybody you read, every book you come across, everything is about small steps. I think a lot of what interestingly along the way, I spent time with, I did work with Jack Canfield, who some people may know, who's a big personal development coach in the US, just recently retired. He has some amazing books called The Success Principles, which are all about guiding people through life, largely through business life as opposed to health life. And then there's other people like Bob Proctor, who very similar type of journey. A lot of people, again, will know him. He's Canadian. He died a couple of years ago, but built this huge organization based on work around a guy called Napoleon Hill, who wrote a book about the most successful people who ever lived in America and how they actually achieved it. Very much driven around the way you think about things. So I have spent a lot of time doing their courses and identify there are certain key principles that people succeed in life. You become a very successful, if you look at the most successful people in this world, they all do the same thing. They all have certain steps they use. So I said, well, hang on a second. Imagine if the prize, instead of being money, was your health. Imagine if the prize was just you change your behavior, you got a good night's sleep, you did all these things, because you know what, I know if you do those things, your heart will be okay. And so I created the program completely around that. I took those principles, I integrated Fogg's small step approach to do that, and then worked out if I could just get people in the right frame of mind. James Clear has a very well-known book called Atomic Habits. James Clear is a graduate of BJ Fogg's. And James Clear talks about trying to take on an identity that you are a healthy person. So I'm a healthy person. So therefore, I'll obviously walk home from this podcast and I'll obviously have a very healthy dinner tonight and lots of glasses of water, as I've said. But the important thing in doing that hugely sets you up for success. But so I have, as we said, I've coached a lot of patients as a group initially in the last couple of years. And I've had a number of business people turn around to me and say, oh, I knew all of that stuff, Robert. But I never realized I could apply it to my life. And so I have one retired CEO who said to me last year that it's amazing. He said, I'm on the Mediterranean diet now. I have fish for dinner 3 days in the week. I've found a whole new purpose in my life. I'm so grateful for this. And every single person who's largely done the program, nearly all the senior executives who've done that with me, all with the exact same feedback, all with it's sort of a certain element that I guide you, that you have some element of accountability. Invariably, if it comes with me, it seems to be somewhat more effective. And the idea of making small steps is easy. That's the important factor. I mean, if I just have to teach you to do a little bit of breath work in the morning, to relax a little bit, to spend a moment with yourself before you get out of bed, just calming, thinking of things you're grateful for, and then just go on and do your day, I'll make a huge amount of progress if I can actually get you to do that every single morning of the week. Or if I can get you to go down to the kitchen and actually take the 2 blueberries out and stick them in a bowl of porridge or whatever it might be. So again, getting you to do those things and putting you in the routine, because they're so easy to do. There's just no excuses not to do them. And then just build out from that. And maybe if you really get this, we can add a little bit more, or you can do a little bit further. And so, I have found, because as I said, I've been coaching it for a long time, that it's really, really effective. A lot of patients in the corporates who do it will say to me, one of the great things is if I have a bad run, I'll just go and take your notes back out again. I just start doing the small steps again, and they work. And I've coached, interestingly, I coached a lot of the senior management in the hospital I work in, and we did a follow-up on the program. What was interesting is that most people became much more engaged in their job, even though we were talking about, sleep and stress and diet and exercise, where they all were kind of much more engaged about that, significantly so. But we got about 90% of people to switch on to their jobs where they were all absolutely miserable. And I did that before COVID even came along.
Wow.
Yeah.
There's a couple of things there. So I want to come back to the engagement in the job, just to understand how that presented itself. But just before, do you get resistance? So when somebody comes to you and you're suggesting, okay, we're going to really have to look at behaviour change, and yes, I can put a stent in, and your colleague passed away and you really need to look at this. Do you get resistance?
Yes, because a lot of people will have the test done and they think they're invincible. So you'll come in, you'll have a scan of the arteries will be normal. You say, sure, it's fine. A lot of people go out of the office after a clinic visit and I'll hear back usually from the wife, so you can work out who they are. Oh, Dr. Kelly told me I'm absolutely fine. There's no reason I should stop drinking the pints and I can do what I like. And anybody who's seen me knows I don't say that. But the point to it is that a lot of people unfortunately make that assumption that because the test is okay, that they're fine. One of the interesting things about the 60% of men with the plaque and the ladies 40% is that the same study shows that there's a sort of a 12 to 15% risk of having a cardiac event in people who have totally normal scans or totally normal arteries. So, it's the same information that comes back consistently again and again. There is an element of resistance that certain people think they know better, and that other people will say, well, I've tried all these things, they don't work, so they bury their heads in the sand a bit. And I kind of try to work with people on a very much an individual basis. I really feel strongly about meeting people where you're at. Some people will want to go and run a marathon. They haven't done one for a couple of years. It's just some people, it's to get you off the couch, to get you to actually go for a walk. And I think that's kind of, again, it just lends itself to a relationship with patients that's really, really a key part of why this works or it doesn't work.
And how long is somebody working with you, somebody that has to make change? There's no solution. They have to make change. How long is somebody on a journey with you before they start to see marker differences in their tests and their bloods versus how they feel in the world?
I would tend to work with people as long as I can, as long as they can, and as long as they want to. If you improve the diet early on, you'll get the cholesterol down pretty quickly. You'll get the weight down. You may get your blood pressure down because you stop eating all the processed food with all the salt in it. Or if you cut the alcohol out for a month, you'll often find a huge transformation in your health. The same is true if you make little changes around the habits that you have at night in terms of going back to work or drinking coffee late at night or eating very late at night. You may find when you have a bit of downtime before you go to bed that the sleep quality improves quite dramatically. So there's a lot of little things you can do that have an immediate impact. Now, I'm a big believer in terms of personalising things to the blood tests you have done. I'm a huge believer in the CTs because sometimes the stress tests and the ultrasounds are normal. And I'm a huge believer in, as I said, trying to help patients in their own different ways and giving them the benefit of time. But there are people who won't show up. And I find it challenging that while I try to help absolutely everybody, some people just don't want to be helped. And some people need a little bit of nudges here and there. And those people who know me, I'm quite persuasive and I'm even more persistent.
I can imagine.
I'm even more persistent. I do firmly believe in what I'm trying to do, but I do respect if you don't want to do it, I can't force you to do anything. It's a choice. You've got to make the choice yourself. Yeah.
Coming back then to when your colleagues at the hospital went through the program and made changes and became more aware of their health, and they reported feeling more engaged in their jobs. Tell me about that. I'm really curious.
I got the great opportunity when I started doing this many years ago to coach a lot of the senior management in the hospital, the CEO, facilitator, which was great. And so they were largely women. There were a few men amongst the group. And one of the things I used to do then is I used to do vision boards with the staff. So they'd all make vision boards about the way they'd like to see their life pan out, say, in the next 6 months. Or get you to write a letter in terms of if you were to write the letters, if it was 30 days later, how life would be if you, based on the goals or the visions that you had for yourself. It was extraordinary to see, for example, one or two of the men on the program who were already patients of mine. They work in the hospital. One in particular, I couldn't get him to change his eating habits. And then out of nowhere on the program, he did a vision board. Men think vision boards are totally woo-woo. And he just had this amazing transformation. He went off and he lost 3 stone in weight. And I mean, just enormously different. That led to him taking more exercise, going to the gym. He even started cooking for himself at home. And I think a lot of the staff felt that somebody was there listening to them is what happened. I think a lot of people didn't know about the stress and the sleep. When you work in the healthcare profession, one of the big challenges is a bit like the women's story I tell about the compassion is that you don't have to burn out. You can get this terrible problem where you're so nice at what you do that it exhausts you. That's called compassion fatigue. But you can get that in any line of work. I mean, you can be a very caring CEO and get the same thing in a non-healthcare organization. But I think the challenge around that for women was that, this group of women in particular, was when they felt they were listened to and they started to identify a lot of things they could do for themselves. And there was an effort to try and do that because I used to do these in groups. So I'd have a Zoom class every week. But then I discovered the girls would say, well, we're going for a walk, Dr. Kelly, tomorrow. We've decided to start a walking group. We meet outside the lift of the hospital at midday every day. We go for a walk for half an hour. And then we ran this thing. We did a Greek salad, Dr. Kelly's Greek salad in the coffee shop in the hospital for a month to try and get people to see we'd encourage them to eat a little bit better. We did a lot of different things like that just to drive the message. But I mean, I was amazed to see the engagement piece. I was amazed to see how high it was. It was across a group of people who work in very different departments in the hospital, but they were interested. And I think a lot of it come from the fact that I was helping them and I was leading them. And as I mentioned about the whole heart reset method, which came from that, I certainly learned an awful lot around the mindset in people in terms of, as a doctor, you really do try to care for people. And I think there's a big trust element that works both ways. So I think when they get that sense of trust of where I'm trying to come at and trying to help them, I mean, anything that was very personal or any deep-rooted, I offered a completely private off-coaching session to talk to me if one wanted to. One of the tricks I did find with coaching a group of people was I developed one day, I noticed that some of the people in the group weren't as committed as everybody else in the group was. So I told the rest of the group that unless the 2 people who weren't committed were committed, then the project couldn't continue.
Wow.
So I put it on them to bring the whole team along because I really wanted to make a team dynamic. I think in one group I gave a bunch of tiny little healthy Easter eggs as a prize for the whole group getting across the line on a run into an Easter program. So I tried to be as inventive and as innovative just to try and learn a little bit. One of the other powerful things I did discover, and I discovered it with them, was when I teach how Fogg's model works, which is you have to have a little bit of motivation to change behavior. So you might say, I'm interested in changing the diet, but you don't have to be so motivated that if you go home tonight and there's no food there that you can't eat and that that the world is going to fall apart. And then once you remember to do it. So Fogg has this story about brushing your teeth and flossing your teeth that when you go to brush your teeth, that's something you do instinctively all the time. You might add another behavior to it, which might be the glass of water one. But what I found as I went with the group is that, again, on that kind of trust dynamic, that I started to teach them how to be grateful. So I taught them a gratitude habit, which was literally to write down 3 things in the morning that you're grateful for. And the key thing about it was that you couldn't just say, well, I'm grateful for dinner and I'm grateful for the job and I'm grateful for Dr. Kelly or whatever it might be. You had to, within your own self, you had to embody it in a way that it meant something to you as to why you were grateful for it. I think the one that's grateful to be alive is something that people should look as to why you should be grateful to be alive. And I actually do that every day. But once you embody that, it makes you feel a certain way for being grateful. So I got them to do this every day. And I often wondered when I went back to the program, what was it that made the program so sustainable? And it was that. The fact that people were more grateful, they were much more self-aware, they were much more self-caring, they were much more willing to do things, they were much more engaged. And
Wow.
so trying to get you into the mindset that you are almost this wonderful person, that you mightn't have seen yourself before, and that you look after yourself and do all these other behaviors is ultimately where the transformation has come. And it's, as I said to you at the beginning, in terms of how I learn and the joys of my journey, is everything I've learned in the last 10 years has come from the people I talk to, from the patients I've spoken to. Okay, I've done a couple of courses that I have, with time, taken little bits of this and little bits of that to make it something. But it's truly come from the conversations that I've had with patients and with clients.
It's huge when you talk about gratitude and self-reflection, and there's an embodiment of self-love in there as well, you know, like starting to care and look inward. And in your opinion, what is peak performance for an executive?
I think peak performance is about having your health obviously in the best order it can be in. And then I think beyond that, it is about your ability to manage your time and work through it from day to day. I don't believe peak performance is about winning a race. And I think that, I'll ask athletes, I have lots of patients who are athletes that want to do bigger events, people who want to cycle the Tour de France because everybody cycles bikes at the weekend, or people who want to do loads of marathons. And a lot of people make this giant assumption that, that they're able to do that at 50 and 60 like they were when they were 20. But a lot of people get referred for that reason to me saying, well, you could get a heart problem in your 50s, and many do. But I'd always say to patients or to executives who come like that, it's just so important to look after the other things. It doesn't matter if you finish the race. That's great. But you won't finish the race if you have to travel to the event and you're jet lagged. Or you might go out with your friends the night before and go and cycle with no sleep. Or you might not train for the event. Or you might ignore all those things. Invariably, the outcomes are not nice. I mean, I know people have had strokes after kind of 5-night cycling event with no sleep and a lot of drinking. So all those other things, a bit like the peak performance, if you don't look after them, from my world, from the medical world, they consistently show bad outcomes. And somebody else shared with me recently of a certain large multinational company where there was concerns around the level of senior executives of health issues in the early 60 age group and trying to identify ways to improve it. And I mean, I've worked with a number of corporate law firms in the UK where I've done some work very similar to this, where unfortunately the motivation is all about peak performance and there's no attention to health in any shape or form. And it goes beyond heart disease. It goes around missing screening visits, for example, amongst women, skipping mammograms, skipping smears because the job becomes more of the focus. And I mean, I'll often say to people, it's great to make 20 million in your job, but when you lose your health along the way, you're not going to have much to enjoy the 20 million that you made with in your life. And I know it's hard to forecast further down your life and say, well, sure, that's not for another 20 years. But as we were saying, where the heart disease develops early in your life, you may not have the luxury either to get to 20 years. You may not have the luxury that your heart's in such a good way. You may, a catastrophic event may happen to you. Only for the fact that, as I've always said, if you make the small little steps along the way, you can transform the opportunity. And, there's a big movement at the minute about everybody wanting to live forever. A lot of it's driven by social media and a certain person's Netflix video. But the reality is you only get to that level in life if you really, really want it by looking after yourself earlier in life. There isn't a magic set of medications. There is not a magic plunge pool or whatever else you think that the fellow beside you is doing. It doesn't work like that. So I think the peak performance, it's like if you ask the runners like the Usain Bolts of this world, all the people who've achieved big steps. It's interesting, I'll share you one story about the heart reset method. There's a wonderful business case in the Harvard Business Review about Roger Bannister. And Roger Bannister is the first man to run the mile in under 4 minutes. And Roger Bannister was a doctor. By coincidence. He was a neurologist, a brain doctor. So Roger Bannister was told by TV, everybody else, that he was absolutely mad. He'd kill himself. His heart would burst out of his chest if he tried to run the mile in under 4 minutes. And he has this great story where he'd check in on himself every 100 yards. He'd measure things. He'd create this picture in his mind. Really take on the identity. He'd already done it. He'd visualize every bit of the process along the way. He'd visualize finishing the ticker tape coming across at the end of the line and actually achieving that by following through on the steps. So it's it does work. It applies to everything else in life. And in the same way, as I said about the health learnings that some of my patients who are very successful CEOs suddenly get, I mean, it's beneficial at any time. I mean, if you're the 70-year-old listening to the call, or if you're the 40-year-old, it is beneficial. In kind of following that same journey by doing those smaller things, you can achieve so much. I mean, Usain Bolt did not run 100 meters in 10 seconds in the first day he went out for a run. I mean, so, the same is true for anything you want to change in life, anything.
Good to have a reminder. What is your own approach to health for you?
I have learned a lot over my lifetime. I've been a cardiologist for 20 years. I've been in practice in Ireland for 19 years. And I kind of taken on very much that small step approach. I now go to the gym 3 or 4 days a week. I think it's really important because I think actually the resistance-based training bit in terms of preserving my back, because I sit in a chair a fair bit, in terms of being mobile. My wife said to me yesterday, it's as simple as, I'd like you around, darling, for at least another 20 years. I said, what? You're not 30. But I'd like that the kids have grandchildren, that you're actually able to run around with them in 20 years' time, as opposed to being stuck in the chair with a big belly and not being able to do anything, which I was kind of going, I tell the patients the same story all the time. And I think that's really, really important. After all, that's a lot of what life is about. I try to be very careful in terms of the diet. I do eat a lot of what's in the Mediterranean diet. Sleep has become a really critical factor for me personally. I find if I don't get a good night's sleep or good quality sleep, I find it very difficult to be fully alert the next day. I find if I do get good sleep for a couple of days or a week or so, that I really do find myself at my peak performance, that things come to me where I wouldn't notice them before. I do the gratitude and the breathing habit every single morning. I've been doing it for the last 4 years. That has really been something of a great learning for me. The big piece has been the whole embodiment around it. And then the stress is like, there's good stress in my life. The stress in the moments of having to deal with very sick patients, I like that stuff personally. But then there's also, the stress that comes with life in general. And so it's really just a question of managing everything. But I've learned from taking one of those at a time. I mean, I started, as I said, the diet piece I love because I've struggled with eating all my life. And I think the physical activity, I've also been in and out. But I found I'm in a CrossFit gym at the minute. I find the dynamic and the group we're in it are great fun. I have a lot of my colleagues medically who are in the gym as well. We just get on with each other. There's a great experience. I mean, we go to the gym, some of us, on a Saturday morning at 7:30. We go for coffee after our session. So it's very, very sociable. And that to me, having tried loads of gyms in my life, that to me, that's what it's all about. It's the experience. It's about enjoying these things. It's about making health part of the experience. It's about making health part of your life. You don't have to call it health if you don't like it. It's about making healthier eating or good food part of your life, or making quality sleep part of your life, or making less stress part of your life because you spend time with the people you love in your life or with your friends, and you get to do things that actually help you perform even better than you could ever possibly imagine in your life. And they make you happy too.
That's incredible. Dr. Kelly, thank you. This honestly has been invaluable. And I hope that our listeners who are, mostly a senior leadership cohort that listen to this, and I really hope that they take something away from this as well, and some motivation to address any concerns, which is important. To wrap up, we've got some fun questions that no doubt you don't want to answer. So if you were stranded on a desert island, what 3 items would you bring and why?
So I asked this question at work because I knew it was coming up. So somebody said a boat, a set of oars and a captain.
So they're thinking of getting away.
Absolutely. Yeah. But then, as I said, when I came here, I said, maybe you wouldn't want to get away. Maybe you just want to sit there and just
be alone.
Enjoy it and just be alone. So I let the listener decide which one I should do.
Time out. That's it. Time to meditate. And what was the last book that you read or podcast that you listened to?
So obviously I'll listen to this podcast when it comes out. But I suppose I read a lot of books. Online. I'm going to have to say the best book is obviously my book, The Heart Book. But other books that I really have enjoyed are, Jack Canfield has great books called The Success Principle books, which are wonderful. BJ Fogg's book that I was referring to is called Tiny Steps, or Tiny Habits is what it's called. So I really enjoy those books. I also really enjoy leadership books. in terms of how one can apply health into leadership.
Yeah.
So people are forever sending me titles of books. And I also enjoy meditation books that people have sent me the names of. So I have about 5 books sitting ready to be read whenever I can find the time to dip into them.
Great. I think the science that has shown up around meditation is just, it's incredible. Like, it really is a transformation. I've been taking an interest myself. So if you're having a dinner party, what 3 guests would you invite?
So I, as I said, do personal development courses, and I'm not going to name this one, but I did one last week which asked you to think about a boardroom experience. And so the boardroom experience is a little bit like this meditation that you, in your own mind, would have a little bit of time just to reflect. You're sitting in the boardroom, you're kind of going, who are 3 other people you'd like to have in the boardroom with you? And just to think of something and see how they'd answer you back. Very similar to the dinner party. So you can have Jesus Christ as an example, could be in the boardroom, or you might have people who would inspire you. And when I did that exercise, a bit like the question, I was thinking, who would I like? And the Dalai Lama is somebody I would like, nice and spiritual, or somebody of that nature. I came up with somebody else's name. I'm not going to say who he is because he got disgraced at the weekend, so I don't want him on the list. I do like kind of inspiring leaders, and it's challenging. I certainly won't think beyond the Atlantic just on this particular context. But I am just, I probably would love to have my father there, actually, in some respects. He's not alive anymore, but just in that. So I'd like somebody inspiring, somebody spiritual. I'd always find that very interesting. And I suppose my wife, I love having a dinner party. She's very sociable.
There you go. Yeah.
And she's a great cook.
Amazing. Thank you so much, Dr. Kelly.